Go. Ready.
So we saw two panels on the inside. The first one was about controlling costs, essentially, utilization.
Wow.
And they said that I shouldn't be controversial. We all know that. We all feel it. Our wallet feels it. And people are going bankrupt because the costs of health insurance keep going up and up and up. Missing from that panel, especially talking about drug prices, they did not talk about removing monopoly prices from drugs, right? It's no mystery why drug prices are so expensive. It's because every time a new one comes out, that company has the monopoly for what, 8 years? That's 8 years where patients will not be able to access care because they are wildly overpriced. They also did not mention insurance, the cost of health insurance at all during this segment, right? It did not mention CEO pay or shareholder value or the high administrative costs of administering a complicated system. Lobbying expenses, right? None of these things are mentioned. It was just how expensive drugs and providers are, right? When we know that's not the drivers of expensive healthcare costs. The second panel we heard from, the view from the marketplace, was a buffet of lies about the New York Health Act, right? They are shaking in their boots because they know we have a majority in the Senate right now, and this bill actually looks like it could pass. They're terrified of it. I mean, Heather Bruschetti actually said that, right?
She is.
What?
She is.
She is scared.
She is what?
Oh, who is she? She is the head of the Business Council, one of the major groups lobbying for this group against the New York Health Act. And we called them out on it, right? We told them they were liars, that the New York Health Act is not going to raise taxes exponentially. It's going to decrease the cost that people are paying for their health care, right? That the New York Health Act will remove deductibles and premiums and co-pays, right? And so the taxes we are paying will actually be less than what we currently spend on our health care. Katie got up and she talked about how these companies are profiteering off the opioid crisis. They are blocking people from accessing alternative therapies like methadone. And what else? Brandon talked about, again, the high cost of drug prices that are keeping people from HIV or who don't want to have HIV from accessing care that would protect them. And I got up and told them that they were all liars and that they say we cannot afford this healthcare system. They say we cannot afford single-payer health insurance, but we know we can't afford this system right now, right?
Yeah.
That's right.
Right.
So that is what happened inside.
What happened to the four of you?
We got let out quite forcefully. They took our badges, they took our signs. But that's okay. We got to say what we came here to say, and we got to stand up and tell them that they are all liars.
Yay! Good work.
Does anybody else who's on inside want to speak?
Sure.
Yeah. Oh yeah, you got to see the whole.
Yeah, tell
I
us
got
what
to see the whole shebang. So I went in early. I was taking notes. It was fascinating. The thing that struck me the most was that whoever was in that room does not reflect the average American. We were talking about health insurance executives, higher-ups for the most part, and it struck me how removed their reality and what they were discussing and how they were discussing it. For instance, they were talking about the consequences if because of
Christmas carolers.
because of the new realities since the 2018 election. There will be some people. So, for example, Some new tweaks might happen to laws that might kick some vulnerable people off in some states. These were numbers, these were quantities, and they were concerned with those vis-a-vis their bottom lines. And that's the frame of mind from which they were approaching this issue. Ours is a paradigm shift from them. It's completely different. We're approaching this from the human side, from the reality side. Okay, we're approaching this from everyday people, the people who are driving their cars right now in traffic, the average American. So the people in there did not represent the average person. That's the take-home message, and that they're profiteers for the most part. All right.
And you are? And from what group?
Yes, Bob. My name is Dimitri, and I'm going to blow my cover. I am a student member of the PNHB chapter board, Physicians for a National Health Program, New York chapter. I'm also a junior scientist at Mount Sinai Medical Center. I don't represent Mount Sinai Medical Center here today. I don't want to be misunderstood, but I do care about health policy and especially about healthcare as a human right, and I'm here to represent that personally.
I'm Katie. I'm from Democratic Socialists of America, and what I want to say is that they are preparing. One of the things they said was, we just elected a bunch of people. We just elected a bunch of people, this is what they said, to state government who have no experience and knowledge about healthcare. And they were disparaging our new representatives, saying it's such a shame that these people who don't know what they're talking about are now in power. And so then they said...
And then Camp Hannon was gone.
And then Camp Hannon was gone. And then they said, so we need to be doing a lot of political education. And we're also going to be doing political education. And what was exciting was that they're preparing, but they didn't know we were in that conference. And they were shocked. And when Lynn got up and started chanting, the woman next to me turned to me and was like, oh my gosh. And then I got up and she was like, oh my gosh. And it was really great because we have the numbers, we have the moral high ground, we have the facts on our side. And I'm excited because they are afraid of us. And you know, one of the head of the Healthcare Association of New York State, which is a lobbyist group for the hospital systems, she helped to torpedo single payer in Vermont, and she said, I lived through it, I have PTSD. And I could tell up there that she was afraid of how, I know, it is laughable. I was like, you don't have that.
She has PTSD, but no insurance.
But what struck me about it was she was afraid because she knows that in Vermont there were numbers on the side of single payer and people really wanted it and they fought hard for it. And so we just have to know their lies in advance. We have to counter them, and we have to keep doing things like this. And it was really exciting. So.
We missed it.
Well, let's give a real round of applause for our 4 heroes who went inside the conference. Great work, speaking truth to power, and exercising your First Amendment rights. So, before we wrap up here, and it's been a cold day, and good for everyone for hanging out, or hanging in for this whole, this whole day of activities. Is there anyone else who would like to just say something about the struggle that we're all engaged in? That today is really just the opening salvo in the campaign to pick at the profiteers and expose the role of the insurance industry and the pharmaceutical industry in denying us health care and pushing forward our demand for universal single-payer health care. So let me give it to Sean and then to you.
Yeah, I just wanted to, acknowledge the fact that, people made a number of small sacrifices to be here today. Some people took time off of work. Some people drove 3 hours, 4 hours to get here. And that, there were moments during the day that was a little confusing, a little, maybe a little low energy. But I think that the spirit of the conference and the picketing that we did, we got a lot of honks of people, driving down there. It validates how wildly popular what we're doing actually is. And also just, I think the information that we got from the inside, the fact that we know that they are afraid. They are worried that Senator Camp Hannon, yeah, I can never say his name right. Kemp Hannon is gone. It was one of the things that they said they were worried about is the fact that he's not there and there's all these new people in the office. So
Kemp Hannon is?
Sorry.
Kemp Hannon was.
Was. Right, was.
Well, actually, I wanted to give the mic just a few minutes to some newcomers that came to the rally at the end. Well, my name is Sean. I'm a nurse in the pediatric ER at Jacobi Medical Center in the Bronx, New York. Member of the New York State Nurses Association. But we have three of my colleagues from NYSNA here. Judy Sheridan Gonzalez, our president of our union, and Joe Farillo, our executive director, and Steve, one of our senior staff people in charge of the single payer campaign. So I wanted to our times got all jumbled up. The conference got all jumbled up. We were going to have different people come at different times, but I just wanted to see if they wanted to say, a brief word just to welcome the group. So.
Well, I know you've all been out here all day, and we just got here, so I don't want to keep you. But, I wore my getting arrested clothes, so I'm a little disappointed that we didn't get the opportunity to do that, especially since it's warmer even in a jail cell than it is out here. But, I think what Sean said is so true. The reason that, they just came out with a report, about this, it's going to cost like $25 trillion to have New York Health in New York State or something. So we know that they're really running scared. After the election and all the work that we've done, and because healthcare was such a big issue in the midterms, and because people really are suffering and are really realizing what the issue is, the attacks are going to be much stronger. So I guess we're going to really have to continue our educational stuff and be very visible. The support that we're getting now is so different than what support we got 10 years ago. Whatever work they did and whatever work we didn't do has now flipped. So with that flipping, now we're going to have to deal with the consequences of it, with the incredible propaganda that's going to come out. So the best we can do is to beat them to the punch, put our propaganda out there, put the truth out there, let people know that this is a system that exists all over the world. And I think, one of the things we might want to do is really look at Saskatchewan, what goes on in Saskatchewan from the past, because that was the latest area in which they got single-payer health care, and they got it in one province at the same time, and the unions were on board. We still have, some kinks to work out with the bill that we do have to work out, but once we get all the unions on board, I think we're going to be unstoppable. So this is fabulous. We want to double this, triple this, and really get some deep strategy going to win this, because the moral issue is so obvious. We are so on the right, on the moral high ground here, and they are so on the low ground. I mean, as nurses, we're the most trusted profession. Insurance companies are the most hated entity that exists in the universe. So how can we lose? But I just think it's fabulous seeing people out here, and I'm so sorry the weather didn't work in our favor, and I'm so sorry we didn't get here in time to do anything more than what we're doing. But thank you so much. It's great to see everybody out here.
Thank you. Thank you.
Thank you, Judy. I just want to say, first of all, commend the people who made the decision before the election to do this action, because I think you had a lot of foresight as to what we are going to need to do to win this fight. And the one thing that we don't want to do is all go home because the elections are over. And so the folks who said, we know that this conference is going to happen, we know that the conference is going to be all about trying to stop this wave, whatever you want to call it, but it was a Medicare for All / New York Health wave, and we're never going to cede that to the opposition. That's what it was. It was healthcare was the central issue under which brought people to the polls to demand this change. So we're not going to cede that to the opposition. Thank you. Thank you, DSA. Thank you, New York Health Act, PNHP, and all the folks who said we're going to be out there right after the election, day one. Because we know in the past that there have been times when we've had victories and the people's movement, the grassroots movement, kind of melted away or fell away or whatever you want to say. And we know that is not a recipe for success. It's a recipe for failure and then backward trends like we've been living with the Trump administration. So I want to say from the bottom of my heart personally and on behalf of our 42,000 members, thank you, brothers and sisters, for your energy in putting this together, and this will only get bigger, and that's how we're going to win. Thank you.
Yeah.
Okay. Well, like you were showing, I took time off from the MTA, which stands for Money Thrown Away. The most recent board meeting was held today, and they discussed the fare and toll increases.
What does MTA stand for?
It stands for Metropolitan Transit Authority, but I call it Money Thrown Away because we're not in the second hour line, we have the second hour stubway. Okay, we got Ronnie Hakeem, who looks and behaves like Wallace and worked by Carter. She missed 5 town hall meetings with Andy Pfeiffer, who's had a shit like a light bulb, missed 2 public hearings. One of them, both of them scheduled to start before 6 p.m. One of them was held on primary election day. I don't know what conditioner the whole public hearing on primary election day. I guess she forgot people campaign, vote, work the polls on that particular day alone. But I asked her, she's stuck on stupid, and at the previous board meeting, I trashed her and Paula Trottenberg, who's killing the city transit department. I told the audience they could pass for the fabulous Mulan Mae Young, the 2 peas in a pot. They know what the hell they're doing. But I'm glad I made it here in Detroit because I first discovered the name between September and November 1989, and I found the maniacs. Oh, well, trying to Detroit, like trying to Albany. So I had to get the MTA the day off. But I originally planned to have the MetLife Stadium for another event, but that event was canceled in preparation for a future event. I mentioned about my ticket online through Ticketmaster yesterday.
Thanks
So
for
I killed 2 birds with 1 stone.
Thanks for coming.
Thank you.
Maybe we should
Anyone
post it
else?
on Facebook to publicize this after all this speeches.
Anybody else?
Sorry, just speaking of the MTA, they name dropped the MTA inside today. They said, look at how well the government is doing running that system. Maybe the government should not run, health insurance. And so I think this is just important to point out that underfunded systems don't perform well, right? And that we should not confuse our politicians taking money away from necessary systems from those systems not working.
Yeah.
One last little just comparison is it's kind of disgusting that, just yesterday they announced that Amazon is going to be building a headquarters, in Long Island City, and the state of New York is going to be giving them $1.5 billion.
2.5.
2.5 total. So there's, but and alongside of, and then at the same breath, not having enough money to fix the subways and to provide health care for every New Yorker. So that don't let them talk about cost. Don't let them say that they can't afford it. We live in one of the richest states in the richest country in the history of the world. So we can fight for that money. It's there. We just need to go get it.
Okay, let's take a break. Yeah, let's take a
Oh, yeah.
with that